Question 1. Assessment of how a certified pet loss grief recovery specialist should respond when a client describes their deceased dog not just as a pet, but as their primary source of emotional support, confidant, and the central figure in their daily routine, highlighting the profound impact of this bond on their current grief. Option A. Advise the client that their grief is likely exaggerated due to overattachment and encourage them to set a strict timeline for moving past this emotional distress. Option B. Focus on validating the client's description of the dog as a central figure and confidant, exploring the specific ways this bond provided support and how its absence is impacting their daily life and emotional state. Option C. Immediately shift the conversation to general grief management techniques, such as mindfulness exercises, without delving into the specifics of the human-animal bond or the client's relationship with their dog. Option D. Gently suggest that while the loss is sad, the client should focus on practical steps like finding a new pet to fill the void, as the dog was just an animal, and many others are available. Correct answer is B. Focus on validating the client's description of the dog as a central figure and confidant, exploring the specific ways this bond provided support and how its absence is impacting their daily life and emotional state. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified pet loss grief recovery specialist to navigate the profound emotional impact of losing a pet, which is often deeply intertwined with the client's sense of self, family structure, and social connections. The specialist must recognize that the grief experienced is not simply sadness over an animal's death, but a complex response to the disruption of a significant relationship. The challenge lies in validating this profound bond and its impact on the client's grief process, while remaining within the ethical and professional boundaries of their role. Correct approach analysis. The correct approach acknowledges and validates the human-animal bond as a central component of the client's grief. This aligns with the core principles of pet loss grief recovery, which emphasizes understanding the unique nature of human-animal relationships and their significance in a person's life. By focusing on the client's narrative of their bond, the specialist demonstrates empathy and a deep understanding of the client's experience. This approach is ethically sound as it prioritizes the client's emotional well-being and respects the depth of their loss. It also implicitly supports the client's journey towards healing by validating the importance of the relationship they have lost. Incorrect approaches analysis. One incorrect approach might involve minimizing the significance of the pet's role in the client's life, perhaps by suggesting the client will easily find another pet, or by focusing solely on the practical aspects of pet ownership. This approach fails to acknowledge the unique and often irreplaceable nature of the human-animal bond, potentially invalidating the client's grief and hindering their healing process. Ethically, this demonstrates a lack of empathy and professional understanding of pet loss grief. Another incorrect approach could be to steer the client away from discussing their feelings about the pet, perhaps by quickly moving to coping mechanisms without first exploring the depth of the relationship. This fails to recognize that understanding the bond is crucial for effective grief processing. It is an ethical failure to bypass the client's emotional experience and the foundational element of their loss. A third incorrect approach might be to impose a specific timeline or expectation for grief resolution, suggesting that the client should be over it by a certain point. This disregards the individual nature of grief and the profound impact of losing a deeply cherished companion. It is ethically problematic to set arbitrary expectations that can lead to feelings of guilt or inadequacy in the grieving individual. Professional reasoning. When faced with a client experiencing pet loss, a certified pet loss grief recovery specialist should first focus on creating a safe and validating space for the client to express their feelings. The initial step involves active listening and empathetic inquiry into the nature of the human-animal bond. This includes understanding the pet's role in the client's life, the shared experiences, and the unique qualities of the relationship. This foundational understanding allows the specialist to tailor their support to the client's specific needs, acknowledging that grief is a personal journey influenced by the depth of the bond. The specialist should then gently guide the client through processing their emotions, offering appropriate coping strategies and resources as the client demonstrates readiness, always reinforcing the validity and significance of their loss. Question 2. Comparative studies suggest that the intensity of grief following pet loss can be influenced by the nature of the human-animal bond. Considering this, a certified pet loss grief recovery specialist is working with a client who is experiencing profound sadness and distress after the passing of their cat, Mittens, who they had for only 2 years. The client describes Mittens as their soulmate and feels Mittens understood them in a way no human ever has. Which of the following approaches best reflects an understanding of attachment theory in this context? Option A. Gently suggest that the grief may be disproportionate to the 2-year duration of ownership and encourage the client to focus on the many other relationships in their life. Option B. Advise the client that their grief is likely a manifestation of underlying loneliness and that acquiring a new pet quickly will resolve these feelings. Option C. Emphasize that while the loss is sad, the client should try to move past it quickly to avoid dwelling on the past and to prevent future attachments from causing similar pain. Option D. Acknowledge the client's deep emotional connection to Mittens, validating their grief as a natural response to the loss of a significant relationship, and explore the unique qualities of their bond. The correct answer is D. Acknowledge the client's deep emotional connection to Mittens, validating their grief as a natural response to the loss of a significant relationship, and explore the unique qualities of their bond. Explanation: this scenario is professionally challenging because it requires a certified pet loss grief recovery specialist to navigate the complex interplay between a client's attachment to their pet and their current grief response, while adhering strictly to the ethical guidelines and regulatory framework of their certification. The specialist must assess the depth and nature of the attachment without pathologizing it, recognizing that strong bonds are normal and healthy. The challenge lies in distinguishing between a healthy, albeit intense, attachment that informs the grief process and potential maladaptive patterns that might require additional consideration, all within the bounds of professional competence and ethical practice. The correct approach represents best professional practice because it prioritizes a client-centered, evidence-informed understanding of attachment theory as it applies to human-animal bonds. By acknowledging the pet as a significant relationship and validating the client's grief as a natural response to the loss of that bond, the specialist fosters a safe and supportive environment. This approach aligns with ethical principles of beneficence and non-maleficence, ensuring the client's emotional well-being is paramount. It also demonstrates a commitment to professional development by integrating theoretical knowledge into practical application, thereby enhancing the quality of care provided. An incorrect approach that focuses solely on the duration of pet ownership as the sole determinant of grief intensity fails to acknowledge the qualitative nature of attachment. This overlooks the fact that even short-term relationships can foster profound bonds, and conversely, long-term relationships may not always be characterized by deep emotional connection. Ethically, this approach risks invalidating a client's genuine grief and can lead to a misdiagnosis of the client's needs, potentially causing further distress. Another incorrect approach that attempts to immediately reframe the loss as a minor event or to rush the client into acquiring a new pet disregards the client's current emotional state and the grieving process. This is ethically unsound as it can be perceived as dismissive and insensitive, potentially damaging the therapeutic alliance and hindering the client's ability to process their loss effectively. It also fails to recognize the unique significance of the lost pet in the client's life. A further incorrect approach that suggests the client's grief is solely a reflection of loneliness or a substitute for human relationships misinterprets attachment theory and the nature of human-animal bonds. While pets can fulfill certain social and emotional needs, the bond is often unique and distinct from human relationships. Ethically, this approach is problematic as it can lead to stigmatization of the client's grief and a failure to provide appropriate support for the specific loss experienced. The professional decision-making process for similar situations should involve a thorough assessment of the client's relationship with their pet, understanding the nuances of their attachment. This includes active listening, empathetic validation of their feelings, and a non-judgmental stance. The specialist should then apply their knowledge of grief and attachment theory to tailor interventions that support the client's individual grieving process, always prioritizing their emotional safety and well-being within the established ethical and regulatory framework. Question 3. The performance metrics show a significant variance in client satisfaction scores related to pet loss grief support, with some clients reporting feeling misunderstood regarding their expressions of grief. Considering the certified pet loss grief recovery specialist's ethical obligation to provide culturally competent care, which of the following approaches best addresses this discrepancy? Option A. Focus solely on standardized grief recovery techniques, believing that these universal methods are sufficient regardless of cultural background. Option B. Assume that the client's expressions of grief are a direct reflection of their individual emotional state, independent of any cultural influences. Option C. Proactively inquire about the client's cultural background and how their family or community traditionally approaches mourning and loss, and integrate this understanding into the support provided. Option D. Interpret any grief expression that deviates from commonly observed patterns as a sign of resistance or difficulty in the grieving process, requiring a more directive intervention. The correct answer is C. Proactively inquire about the client's cultural background and how their family or community traditionally approaches mourning and loss, and integrate this understanding into the support provided. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent diversity in how individuals and communities experience and express grief following the loss of a pet. A certified pet loss grief recovery specialist must navigate these variations with sensitivity and competence. Failure to acknowledge and respect cultural differences can lead to ineffective support, client alienation, and a breach of ethical practice. The specialist's role requires a deep understanding that grief is not a monolithic experience, and that cultural norms significantly shape its outward manifestation, the rituals surrounding loss, and the acceptable ways of seeking or receiving comfort. Correct approach analysis. The correct approach involves actively seeking to understand the client's cultural background and how it influences their grief expression. This aligns with ethical guidelines that mandate culturally competent care. Best professional practice dictates that a specialist should inquire about the client's cultural beliefs, family traditions, and community practices related to loss and mourning. This proactive approach allows the specialist to tailor their interventions to be culturally relevant and respectful, ensuring the client feels understood and validated. It demonstrates a commitment to providing individualized care that honors the client's unique worldview and coping mechanisms, thereby fostering trust and facilitating the healing process. This approach is grounded in the ethical imperative to provide non-discriminatory and client-centered services. Incorrect approach is analysis. One incorrect approach is to assume that the client's grief expression is universal or follows a single, dominant cultural model. This can lead to misinterpretations of the client's behavior, potentially labeling behaviors that are culturally normative as problematic or indicative of a lack of progress. This demonstrates a failure in cultural humility and can result in the specialist imposing their own cultural biases, which is an ethical violation. Another incorrect approach is to dismiss or minimize expressions of grief that do not conform to the specialist's expectations, particularly if those expectations are shaped by a different cultural lens. For instance, if a client's culture emphasizes stoicism, a specialist might incorrectly interpret this as a lack of distress, failing to recognize that grief can be expressed internally. This can lead to inadequate support and a missed opportunity to help the client process their loss effectively. Ethically, this constitutes a failure to provide appropriate and sensitive care. A third incorrect approach is to offer generic, one-size-fits-all grief support strategies without considering the client's cultural context. While some core principles of grief recovery may be universal, the application and expression of these principles are heavily influenced by culture. Applying interventions that are culturally inappropriate can be ineffective at best and deeply offensive at worst, violating the ethical duty to provide competent and respectful services. Professional reasoning. Professionals should adopt a framework of cultural humility, recognizing that they do not know everything about a client's cultural background and being open to learning. This involves active listening, asking open-ended questions about cultural beliefs and practices related to loss, and observing the client's cues. It requires a commitment to continuous learning about diverse cultural expressions of grief. When faced with a client whose grief expression differs from one's own cultural norms, the professional should pause, reflect on potential cultural influences, and inquire rather than assume. The goal is to build a therapeutic alliance based on mutual respect and understanding, ensuring that interventions are not only effective, but also culturally sensitive and ethically sound. Question 4. To address the challenge of supporting a client experiencing profound grief after the loss of their pet, how should a certified pet loss grief recovery specialist best consider the role of attachment in shaping the client's grief response? Option A. By assuming that grief intensity is primarily determined by the length of time the client owned the pet. Option B, by prioritizing the grief associated with human loss as inherently more significant than pet loss, thereby downplaying the client's attachment to their pet. Option C, by applying a standardized grief model based on the pet species or breed, irrespective of the individual human-animal bond. Option D, by exploring the client's specific attachment style to their pet and how this bond may influence the intensity, expression, and duration of their grief. The correct answer is D, by exploring the client's specific attachment style to their pet and how this bond may influence the intensity, expression, and duration of their grief. Explanation: this scenario is professionally challenging because the certified pet loss grief recovery specialist must navigate the deeply personal and often complex nature of attachment to a pet, recognizing that the intensity and expression of grief are directly influenced by the strength and type of this bond. The specialist needs to apply theoretical knowledge of attachment in a way that is sensitive, individualized, and ethically sound, without imposing personal beliefs or making assumptions about the client's experience. Careful judgment is required to validate the client's feelings, regardless of how they manifest, and to tailor interventions to their specific attachment style and grief process. The correct approach represents best professional practice because it acknowledges the foundational role of attachment in shaping the grief experience. By understanding that secure attachment can lead to a grief process that, while painful, is often characterized by a sense of enduring connection and eventual integration, and that insecure attachment styles may present with more complex grief reactions, e.g., prolonged grief, avoidance, or intense distress. The specialist can offer more targeted and effective support. This approach aligns with ethical guidelines that emphasize client-centered care, empathy, and the recognition of individual differences in grief. It allows for validation of the client's unique bond and the subsequent grief, fostering a safe space for exploration and healing. An incorrect approach that focuses solely on the duration of pet ownership as the primary determinant of grief intensity fails to acknowledge the qualitative aspects of the attachment bond. This is an ethical failure as it risks invalidating the client's experience, particularly if the pet was a companion for a shorter period, but formed a profound attachment. It also overlooks the potential for intense grief in situations where the attachment was insecure or complicated by other life stressors. Another incorrect approach that dismisses the significance of pet attachment as being less profound than human attachment is a significant ethical and professional failing. This devalues the human-animal bond, which is widely recognized in the field of grief counseling. It can lead to a lack of empathy, inappropriate interventions, and a failure to meet the client's emotional needs, potentially causing further distress and hindering the grief recovery process. This approach violates the core principles of compassionate care and professional competence. A third incorrect approach that attempts to standardize the grief process based on a pet species or breed ignores the individual nature of the human-animal bond and the unique relationship dynamics. This is an ethical failure because it imposes a generalized framework that does not account for the specific attachment formed between the client and their individual pet, leading to a one-size-fits-all approach that is unlikely to be effective and may feel dismissive to the client. A professional decision-making process for similar situations should involve a thorough assessment of the client's relationship with their pet, exploring the nature of their attachment, the perceived role of the pet in their life, and the client's individual coping mechanisms. The specialist should then integrate this understanding with established grief theories, particularly those that highlight the role of attachment, to collaboratively develop a personalized support plan. This plan should prioritize validation, empathy, and the provision of evidence-based interventions tailored to the client's unique grief journey, always adhering to ethical standards of care and professional boundaries. Question 5. Strategic planning requires a nuanced understanding of the core concepts underpinning effective client support. For a certified pet loss grief recovery specialist, how should grief be fundamentally defined to ensure the most appropriate and ethical client care? Option A. Grief is a universal, predictable, and time-limited emotional response to loss that primarily manifests as sadness. Option B. Grief is a psychological disorder that requires immediate clinical intervention to prevent long-term mental health issues. Option C. Grief is a complex, multifaceted, and individual experience encompassing a wide range of emotional, cognitive, behavioral, and physical reactions to loss, and is a natural response to bereavement. Option D. Grief is a purely cognitive process focused on rationalizing the loss and accepting its inevitability. The correct answer is A. Grief is a universal, predictable, and time-limited emotional response to loss that primarily manifests as sadness. Explanation: this scenario is professionally challenging because the definition of grief, while seemingly straightforward, is complex and deeply personal. As a certified pet loss grief recovery specialist, understanding and applying this definition accurately is paramount to providing effective and ethical support. Misinterpreting or oversimplifying grief can lead to inadequate interventions, client dissatisfaction, and potentially harm. Careful judgment is required to acknowledge the multifaceted nature of grief, encompassing emotional, cognitive, behavioral, and physical responses, and to recognize that it is not a linear process. The correct approach represents best professional practice because it aligns with the core principles of grief counseling and the ethical guidelines expected of a certified pet loss grief recovery specialist. Acknowledging grief as a natural, albeit painful, response to loss, and understanding its varied manifestations allows for a more empathetic and tailored approach to client care. This perspective validates the client's experience and forms the foundation for building trust and facilitating healing. It respects the individual's unique journey through loss without imposing external timelines or expectations. An incorrect approach that defines grief solely as sadness or a temporary emotional state fails to recognize the broader spectrum of grief reactions. This can lead to a specialist dismissing or minimizing other significant aspects of a client's experience, such as anger, guilt, or physical symptoms, thereby hindering their ability to process the loss fully. Ethically, this approach could be seen as a failure to provide competent care, as it demonstrates a lack of understanding of the subject matter. Another incorrect approach that views grief as a pathological condition requiring immediate intervention, without considering the client's individual context and coping mechanisms, is also professionally unacceptable. While some grief reactions may require specialized attention, framing all grief as inherently problematic can pathologize a normal human experience and may lead to unnecessary or inappropriate interventions. This can undermine a client's resilience and their natural capacity to adapt to loss. The professional decision-making process for similar situations should involve a commitment to continuous learning and adherence to professional ethical codes. Specialists should prioritize active listening, empathy, and a client-centered approach when faced with ambiguity, consulting with supervisors or experienced colleagues, and referring to established grief models and research are crucial steps. The focus should always be on supporting the client's individual process of recovery, respecting their unique experience of loss, and operating within the scope of practice defined by the certification. Question 6. The assessment process reveals that a client who recently lost their beloved dog of 15 years expresses intense sorrow, stating, "I feel like I've lost a child. No one understands how much this hurts." The certified pet loss grief recovery specialist is aware that a common societal misconception is that grief over a pet is inherently less profound than grief over a human family member. How should the specialist best respond to this client's statement? Option A. Suggest that their grief might be amplified due to the lack of societal recognition for pet loss compared to human loss, and encourage them to seek comfort in other relationships that are more readily understood. Option B. Gently acknowledge the depth of their pain and validate the significance of their bond with their pet, explaining that the human-animal bond can be as profound as other family relationships and that their grief is a natural and understandable response to a significant loss. Option C. Reassure the client that it's normal to feel this way, but that the intensity of their grief will likely subside much faster than if they had lost a human family member, as pets are not the same as human dependents. Option D. Advise the client that while their feelings are understandable, they should try to focus on the positive memories and avoid dwelling on the sadness, as it's important to move on quickly from pet loss. The correct answer is B. Gently acknowledge the depth of their pain and validate the significance of their bond with their pet, explaining that the human-animal bond can be as profound as other family relationships and that their grief is a natural and understandable response to a significant loss. Explanation. Scenario analysis. This scenario presents an ethical dilemma stemming from a common misconception about pet loss, the belief that the grief experienced is less significant or valid than human grief. This misconception can lead to a client feeling invalidated, misunderstood, and unsupported, potentially hindering their grieving process and damaging the professional relationship. The certified pet loss grief recovery specialist must navigate this by affirming the client's experience while gently correcting the underlying misconception without causing further distress. Correct approach analysis. The correct approach affirms the client's feelings and validates their experience of profound grief. It acknowledges the unique bond between humans and their pets and reframes the loss as significant and deserving of compassionate support. This aligns with the ethical principles of empathy, respect, and client-centered care inherent in the certified pet loss grief recovery specialist role. By validating the client's emotions, the specialist builds trust and creates a safe space for the client to process their grief effectively, which is the core of their professional mandate. Incorrect approaches analysis. One incorrect approach dismisses the client's feelings by suggesting their grief is exaggerated or disproportionate to the loss of a pet. This directly contradicts the ethical imperative to provide non-judgmental support and invalidates the client's lived experience. It reinforces the harmful misconception that pet loss is a lesser form of grief, potentially causing the client to feel ashamed or isolated. Another incorrect approach attempts to quickly move past the client's expression of grief by immediately offering platitudes or distractions. While well-intentioned, this can be perceived as a way to avoid confronting the depth of the client's pain, thereby failing to provide adequate support. It bypasses the crucial step of acknowledging and validating the grief, which is essential for recovery. A third incorrect approach might involve comparing the client's loss to other types of losses in a way that diminishes the significance of their pet loss. This can inadvertently create a hierarchy of grief, implying that some losses are more worthy of mourning than others, which is ethically unsound and unhelpful to the grieving individual. Professional reasoning. Professionals should approach such situations by first actively listening and empathizing with the client's expressed emotions. The focus should be on validating their feelings and acknowledging the depth of their bond with their pet. If the opportunity arises naturally and sensitively, the specialist can then gently educate about the nature of human-animal bonds and the validity of pet loss grief, reframing it as a significant bereavement. The decision-making process involves prioritizing the client's emotional well-being and therapeutic needs above all else, ensuring that interventions are supportive, respectful, and evidence-informed regarding grief processes. Question 7. The assessment process reveals that a client grieving the loss of their beloved cat primarily communicates their feelings and memories through a collection of specific objects they have brought to the session. They seem hesitant to speak directly about the loss itself, which approach best supports their narrative construction and grief recovery. Option A. Gently inquire about the stories and emotions the client associates with each object, allowing them to lead the narrative and explore the symbolic meaning at their own pace. Option B. Suggest the client focus on abstract concepts of loss and resilience, as objects can be a distraction from deeper emotional work. Option C. Directly ask the client to recount specific memories of their cat related to each object to facilitate a more direct processing of grief. Option D. Interpret the symbolic meaning of the objects for the client, offering insights into their grief journey based on common associations. The correct answer is A. Gently inquire about the stories and emotions the client associates with each object, allowing them to lead the narrative and explore the symbolic meaning at their own pace. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified pet loss grief recovery specialist to navigate a client's deeply personal and often fragmented experience of loss. The client's reluctance to articulate their narrative directly, coupled with their reliance on external objects to convey their feelings, necessitates a sensitive and indirect approach. The specialist must balance the therapeutic goal of narrative construction with the client's current emotional state and communication style, ensuring the process is client-led and empowering. Correct approach analysis. The correct approach involves gently guiding the client to explore the stories embedded within the objects they have chosen. This aligns with narrative therapy principles, which posit that individuals can reauthor their lives by externalizing problems and exploring alternative narratives. By focusing on the objects, the specialist creates a safe space for the client to express their grief without direct confrontation of painful memories. This method respects the client's pace and communication preferences, fostering a sense of agency and control over their grief journey. It is ethically sound as it prioritizes client autonomy and well-being, adhering to the core tenets of client-centered care within the framework of pet loss grief recovery. Incorrect approaches analysis. One incorrect approach involves directly asking the client to recount specific memories associated with each object. This fails to acknowledge the client's current difficulty in verbalizing their grief and could lead to overwhelm or further withdrawal, potentially re-traumatizing them. Ethically, this approach disregards the client's expressed communication style and could be perceived as intrusive. Another incorrect approach is to dismiss the significance of the objects and steer the conversation towards abstract concepts of loss. This invalidates the client's chosen method of expression and fails to leverage the powerful symbolic meaning these objects hold. It is ethically problematic as it imposes the specialist's agenda rather than facilitating the client's own process of meaning-making. A third incorrect approach is to interpret the object's meanings for the client without their explicit input. While well-intentioned, this can lead to misinterpretations and can disempower the client by taking away their voice and defining their own narrative. This violates the principle of client autonomy and can hinder the development of a personal, empowering story of grief and recovery. Professional reasoning. When faced with a client who communicates through objects rather than direct verbalization, a certified pet loss grief recovery specialist should employ a client-centered, narrative-informed approach. The decision-making process involves 1. Active listening and observation to understand the client's preferred communication style. 2. Gently acknowledging and validating the client's chosen method of expression, in this case, the objects. 3. Using open-ended, non-judgmental questions that invite exploration of the symbolic meaning of the objects, allowing the client to lead the narrative. 4. Collaboratively constructing a story that honors the client's experience and fosters a sense of agency and hope for the future. This process prioritizes the client's emotional safety and therapeutic needs above all else. Question 8. Consider a scenario where a client, grieving the recent loss of their beloved dog, reports experiencing persistent insomnia, a constant knot in their stomach, and unexplained fatigue. As a certified pet loss grief recovery specialist, how should you best address these reported physical responses to grief? Option A. Focus exclusively on processing the emotional aspects of the loss, reassuring the client that physical symptoms will naturally subside once the emotional pain is resolved. Option B. Advise the client to seek immediate medical attention from a physician to rule out any underlying physical health issues, as these symptoms are beyond the scope of grief recovery support. Option C. Validate the client's physical experiences as common manifestations of grief, normalize these responses, and explore coping strategies for managing them within the context of their emotional healing journey. Option D. Suggest that the physical symptoms are likely psychosomatic, and encourage the client to try relaxation techniques without further exploration of their connection to the grief process. The correct answer is C. Validate the client's physical experiences as common manifestations of grief, normalize these responses, and explore coping strategies for managing them within the context of their emotional healing journey. Explanation. This scenario is professionally challenging because it requires a certified pet loss grief recovery specialist to navigate the complex and often distressing physical manifestations of grief in a client, while adhering to professional ethical guidelines and maintaining appropriate boundaries. The specialist must recognize that physical symptoms are a valid and significant part of the grief process, not merely psychosomatic complaints to be dismissed. The correct approach represents best professional practice because it acknowledges and validates the client's physical experiences as a direct consequence of their emotional distress. This aligns with the ethical imperative to provide compassionate, client-centered care that addresses the whole person, including their physical well-being. By normalizing these responses and offering appropriate support and resources, the specialist fosters trust and facilitates the client's healing journey. This approach is grounded in the understanding that grief impacts all aspects of an individual's life. An incorrect approach that focuses solely on emotional processing without acknowledging the physical symptoms would be ethically deficient. It fails to provide holistic support and may inadvertently invalidate the client's experience, potentially leading to feelings of isolation or misunderstanding. This could be seen as a failure to meet the client's needs comprehensively, which is a core ethical responsibility. Another incorrect approach that involves diagnosing or treating the physical symptoms as a separate medical condition without referral would overstep the specialist's scope of practice. Certified pet loss grief recovery specialists are not medical professionals and are ethically bound to recognize the limits of their expertise. Recommending medical interventions or attempting to manage physical ailments directly would be a violation of professional boundaries and could potentially harm the client by delaying or misdirecting appropriate medical care. A professional decision-making process for similar situations should involve active listening to fully understand the client's reported experiences, both emotional and physical. The specialist must then assess the reported physical symptoms within the context of grief, differentiating between common grief-related physical responses and those that may require medical attention. This assessment guides the specialist in validating the client's experience, normalizing common physical responses, and, when necessary, ethically recommending consultation with appropriate medical professionals. Maintaining clear boundaries regarding the scope of practice is paramount throughout this process. Question 9. The investigation demonstrates that a client is experiencing intense emotional distress following the death of their beloved cat of 15 years. The client expresses feelings of deep sadness, guilt, and a sense of profound emptiness. However, during a support group session facilitated by a certified pet loss grief recovery specialist, another participant makes a dismissive comment stating, "It was just a cat, you'll get over it." The client becomes visibly upset and withdraws. What is the most ethically sound and professionally appropriate response for the certified pet loss grief recovery specialist to address this situation and support the grieving client? Option A. Ignore the dismissive comment to avoid further conflict within the group and focus on the planned agenda for the session, hoping the grieving client will eventually disregard the remark. Option B. Privately speak with the grieving client after the session, suggesting they try to be less emotional about the loss to avoid upsetting others in the group. Option C. Acknowledge the comment briefly and then steer the conversation back to the grieving client's experience, focusing on practical advice for managing daily routines without their pet to help them move forward. Option D. Immediately intervene by firmly addressing the participant who made the dismissive comment, stating that pet loss is a significant bereavement and that such comments are inappropriate and harmful, while then turning to the grieving client to validate their feelings and offer reassurance that their grief is normal and understandable. The correct answer is D. Immediately intervene by firmly addressing the participant who made the dismissive comment, stating that pet loss is a significant bereavement and that such comments are inappropriate and harmful, while then turning to the grieving client to validate their feelings and offer reassurance that their grief is normal and understandable. Explanation. This scenario is professionally challenging because it requires navigating the intersection of personal grief, societal perceptions, and professional ethical obligations. The certified pet loss grief recovery specialist must balance validating the client's profound emotional experience with addressing the external stigma that often minimizes pet bereavement. Careful judgment is required to provide effective support without inadvertently reinforcing societal biases or overstepping professional boundaries. The correct approach represents best professional practice because it directly confronts the stigma by normalizing the client's grief and validating its significance. This aligns with the ethical imperative to provide compassionate, client-centered care that acknowledges the depth of the human-animal bond and the resulting grief. By framing the loss as a significant bereavement, the specialist empowers the client and combats the societal tendency to dismiss such losses as just a pet. This approach upholds the professional's role in providing specialized support for a recognized form of grief. An incorrect approach that dismisses or minimizes the client's grief as just a pet is a significant ethical failure. It violates the core principle of providing empathetic and validating support. This approach fails to recognize the profound impact of pet loss and can exacerbate the client's feelings of isolation and invalidation, potentially hindering their grieving process. It also fails to uphold the professional's responsibility to educate and advocate for the understanding of pet bereavement. Another incorrect approach that focuses solely on the practical aspects of pet loss, such as disposal or replacement, without acknowledging the emotional toll, is also professionally unacceptable. This neglects the emotional and psychological needs of the grieving client, treating the situation as a logistical problem rather than an emotional crisis. It demonstrates a lack of understanding of the grief recovery process and a failure to provide holistic support. A further incorrect approach that suggests the client should get over it quickly because it was only an animal directly perpetuates the harmful stigma surrounding pet loss. This is a gross ethical violation, as it invalidates the client's experience and demonstrates a profound lack of empathy and professional competence in grief support. It actively harms the client by reinforcing the very societal attitudes that make pet bereavement so difficult to navigate. The professional decision-making process for similar situations should involve a commitment to client-centered care, active listening, and empathetic validation. Professionals must be educated on the nature of pet loss grief and its societal context. They should be prepared to normalize the client's feelings, educate them about the grieving process, and provide a safe space for expression. Advocacy for the recognition of pet bereavement as a legitimate form of grief is also a crucial component of professional practice. Question 10. Upon reviewing a client's situation where their beloved pet has been diagnosed with a terminal illness, and the client expresses profound sadness and anxiety about the impending loss, even though the pet is still alive and relatively comfortable, what is the most appropriate initial course of action for a certified pet loss grief recovery specialist? Option A. Offer direct advice and recommendations regarding the timing and methods of euthanasia, as this is a primary concern for clients in this situation. Option B. Gently inform the client that grief is premature and focus solely on enjoying the remaining time with the pet, advising them to postpone emotional processing until after the pet has passed. Option C. Immediately suggest the client begin researching and selecting a new pet to help ease the transition and prepare for life after the current pet's passing. Option D. Validate the client's feelings of anticipatory grief and explore coping strategies for the present emotional distress, while maintaining open communication about the pet's current well-being and the client's needs. The correct answer is D. Validate the client's feelings of anticipatory grief and explore coping strategies for the present emotional distress, while maintaining open communication about the pet's current well-being and the client's needs. Explanation. This scenario is professionally challenging because it requires the certified pet loss grief recovery specialist to navigate the complex emotional landscape of a client experiencing anticipatory grief for a terminally ill pet. The specialist must balance empathy with professional boundaries, recognizing that while the pet is still alive, the client is already experiencing significant loss. This requires a nuanced understanding of grief stages and the unique bond between humans and animals, which often rivals human-to-human relationships in its intensity and impact. The correct approach represents best professional practice because it acknowledges and validates the client's current emotional state without prematurely declaring the grief over or minimizing the impending loss. This aligns with ethical guidelines for grief counseling, which emphasize meeting the client where they are and providing support for their present experience. By focusing on coping strategies for anticipatory grief and maintaining open communication, the specialist fosters a safe space for the client to process their emotions, which is crucial for a healthier grieving process once the pet has passed. This approach respects the client's autonomy and their unique grieving journey. An incorrect approach that focuses solely on the pet's current survival and dismisses the client's feelings as premature would be ethically problematic. It fails to recognize the validity of anticipatory grief and could lead to the client feeling invalidated and unsupported, potentially hindering their ability to cope. This disregards the core principle of client-centered care. Another incorrect approach that involves immediately shifting the focus to acquiring a new pet before the current pet has passed would be premature and potentially harmful. This can be interpreted as a way to avoid the difficult emotions associated with the impending loss, rather than processing them. Ethically, this approach bypasses the necessary grieving process and could lead to unresolved issues and a less meaningful connection with a future pet. A further incorrect approach that involves offering unsolicited advice on euthanasia without being directly asked or without a thorough understanding of the client's specific situation and the pet's prognosis would be a significant ethical breach. This oversteps professional boundaries and can place undue pressure on the client during an already vulnerable time. The professional decision-making process for similar situations should involve 1. Active listening to fully understand the client's emotional state and concerns. 2. Validating the client's feelings, even if they seem anticipatory. 3. Assessing the client's current coping mechanisms and identifying areas where support is needed. 4. Collaborating with the client to develop strategies for managing anticipatory grief, focusing on present-moment coping and self-care. 5. Maintaining clear professional boundaries while offering compassionate support. Question 11. Operational review demonstrates that a client is experiencing profound grief following the death of their beloved cat. The client expresses feelings of isolation, stating that friends and family do not understand the depth of their pain, often remarking, "It was just a cat." The certified pet loss grief recovery specialist is considering how to best support this client. Which of the following approaches most accurately reflects best professional practice in this context? Option A. Acknowledge the client's feelings of isolation and validate the significance of their bond with their cat, explaining that grief over pet loss is a unique and often disenfranchised experience that requires specialized support, and then proceed with tailored grief recovery interventions. Option B. Advise the client to seek support from general grief counseling services. As the core principles of grief are universal, and specialized pet loss support is not significantly different from human loss support. Option C. Suggests that the client might be over-identifying with the pet, and that focusing on the loss of a human family member, if applicable, would be a more appropriate therapeutic direction. Option D. Emphasize that while their grief is valid, it is important to remember that human losses are generally more complex and socially recognized, encouraging them to focus on the broader spectrum of human bereavement. The correct answer is D. Emphasize that while their grief is valid, it is important to remember that human losses are generally more complex and socially recognized, encouraging them to focus on the broader spectrum of human bereavement. Explanation. This scenario presents a professional challenge because it requires a certified pet loss grief recovery specialist to navigate the nuanced differences between human and pet loss, ensuring that their approach is both empathetic and ethically sound, adhering strictly to the guidelines of their certification. The core difficulty lies in recognizing that, while grief shares universal human experiences, the societal context, legal standing, and relational dynamics surrounding pet loss can differ significantly from human bereavement. This necessitates a specialized understanding that goes beyond general grief counseling. The correct approach represents best professional practice because it acknowledges and respects the unique nature of the human-animal bond and the specific ways in which pet loss can impact an individual. It prioritizes validating the client's grief as legitimate and significant, without minimizing it by comparison to human loss. This aligns with the ethical imperative of providing client-centered care, which means tailoring interventions to the individual's experience and cultural understanding of their loss. The specialist's role is to support the client's grieving process, not to dictate its validity or intensity based on the species of the lost companion. An incorrect approach that fails to differentiate between human and pet loss risks invalidating the client's experience. This could manifest as implicitly or explicitly suggesting that their grief is less profound or acceptable because it pertains to an animal rather than a human. Such an approach is ethically problematic, as it can lead to further isolation and distress for the grieving individual, undermining the specialist's role as a supportive professional. Fails to meet the standard of care expected from a certified pet loss grief recovery specialist, who is trained to understand and address the specific complexities of this type of bereavement. Another incorrect approach might involve applying therapeutic models developed solely for human bereavement without adaptation. While some core principles of grief work are transferable, the specific rituals, social support systems, and societal acknowledgement surrounding pet loss often differ. Failing to account for these differences can lead to interventions that are not fully resonant or effective for the client. Ethically, this represents a failure to utilize specialized knowledge and skills for which the certification was granted. The professional decision-making process for similar situations should involve a thorough assessment of the client's individual experience, their relationship with the pet, and their personal and cultural context of loss. The specialist must actively listen to the client's narrative, validate their feelings without judgment, and employ therapeutic techniques that are appropriate for pet loss grief. This includes being aware of common challenges such as lack of societal recognition, disenfranchised grief, and the unique nature of the human-animal bond. The specialist's primary ethical duty is to provide competent and compassionate care tailored to the specific needs of a client grieving the loss of a pet. Question 12. Examination of the data shows a client expressing intense sadness and a feeling of disbelief following the recent death of their beloved cat. The client states, "I just can't believe he's gone. It feels like a bad dream I'll wake up from." Based on the Kubler-Ross model of grief, which of the following approaches best reflects a sensitive and effective response from a certified pet loss grief recovery specialist? Option A, suggesting that they should focus on the positive memories and try to distract themselves from the pain to avoid getting stuck in the denial phase. Option B, reassuring them that everyone grieves differently and that they will eventually feel better, encouraging them to focus on finding a new pet soon. Option C, gently explaining that disbelief is the first stage of grief and that they should try to move towards acceptance to begin the healing process. Option D, acknowledging the client's feelings of disbelief and sadness, validating their experience, and offering to explore these feelings further without suggesting a specific timeline for their grief. Correct answer is D. Acknowledging the client's feelings of disbelief and sadness, validating their experience, and offering to explore these feelings further without suggesting a specific timeline for their grief. Explanation. This scenario presents a professional challenge because grief is a highly individual and non-linear process, and applying a rigid model like the Kubler-Ross stages without nuance can lead to misinterpretation and ineffective support. The certified pet loss grief recovery specialist must recognize that while the Kubler-Ross model offers a framework, individuals do not necessarily progress through these stages in a predictable order, nor do they experience all of them. The core ethical responsibility is to provide compassionate, client-centered support that acknowledges the client's unique experience of loss. The correct approach represents best professional practice because it acknowledges the client's current emotional state without imposing a predetermined path of grief. It focuses on validating their feelings, offering a safe space for expression, and providing resources that are adaptable to their individual journey. This aligns with the ethical guidelines of client autonomy and non-maleficence, ensuring that the specialist does not inadvertently cause distress by suggesting the client is behind or wrong in their grieving process. The specialist's role is to facilitate, not dictate, the recovery process. An incorrect approach that assumes the client must be in a specific stage of grief, such as denial or anger, and attempts to move them along to the next stage, is ethically flawed. This approach fails to respect the client's individual experience and can be invalidating, potentially exacerbating their distress. It also violates the principle of competence, as it demonstrates a misunderstanding of the complexities of grief. Furthermore, it could be seen as a failure to adhere to professional standards that emphasize empathy and individualized care. Another incorrect approach might involve offering platitudes or minimizing the client's pain, by suggesting that time heals all wounds without actively engaging with their current emotional reality. This is ethically problematic as it dismisses the client's immediate needs and can be perceived as a lack of genuine empathy. It also fails to provide practical support or acknowledge the depth of their loss. The professional decision-making process for similar situations should begin with active listening and empathetic attunement to the client's expressed feelings and experiences. The specialist should then assess the client's current emotional state and needs, drawing upon their knowledge of grief models as a guide, but not as a rigid prescription. The focus should always be on providing tailored support that empowers the client and respects their unique journey through loss. Question 13. Performance analysis shows that a family is experiencing significant distress following the loss of their beloved dog. The family consists of 2 parents and 2 children, aged 7 and 11. The parents are visibly upset, and the 7-year-old has become withdrawn, while the 11-year-old is exhibiting increased irritability and acting out at school. What is the most appropriate initial approach for a certified pet loss grief recovery specialist to take in assessing and supporting this family? Option A. Implement a standardized grief counseling protocol for all family members, assuming a uniform grieving process and timeline for everyone. Option B. Conduct a comprehensive family assessment, observing and discussing the grief responses of each member, including age-appropriate strategies for the children, and collaboratively developing a family-centered grief recovery plan. Option C. Focus primarily on supporting the parents' grief, as they are the primary decision makers and their emotional state will likely dictate the family's overall recovery. Option D. Advise the parents that children's grief is typically less intense than adult grief and suggest they encourage the children to get over it quickly to maintain family stability. The correct answer is B. Conduct a comprehensive family assessment, observing and discussing the grief responses of each member, including age-appropriate strategies for the children, and collaboratively developing a family-centered grief recovery plan. Explanation. This scenario is professionally challenging because the impact of pet loss on families and children is multifaceted and can manifest in diverse ways, requiring a nuanced understanding of grief dynamics. A certified pet loss grief recovery specialist must navigate the emotional complexities of individual family members, recognizing that children may express grief differently than adults, and that family systems can be significantly disrupted. Careful judgment is required to tailor interventions to the specific developmental stages and emotional needs of each family member, ensuring a supportive and validating environment. The correct approach represents best professional practice because it prioritizes a holistic, family-centered assessment and intervention strategy. This aligns with ethical guidelines that emphasize client-centered care and the importance of understanding the unique context of each family's experience. By acknowledging the interconnectedness of family members' grief and providing age-appropriate support, the specialist fosters a healthier grieving process for all involved, promoting resilience and understanding within the family unit. This approach respects the individual grieving journeys while also addressing the collective impact on the family system. An incorrect approach that focuses solely on the adult caregiver's grief fails to recognize the distinct and often profound impact pet loss has on children. This is an ethical failure, as it neglects a significant portion of the family unit's needs, and can lead to children feeling unheard or invalidated in their grief. It also overlooks the potential for children's grief to influence or be influenced by adult grief, creating a less effective overall recovery process. Another incorrect approach that dismisses children's grief as less significant than adult grief is a critical ethical and professional failing. This devalues the child's emotional experience and can lead to long-term emotional consequences for the child. It demonstrates a lack of understanding of child development and grief processing, and it violates the principle of providing equitable and appropriate support to all individuals experiencing loss. A third incorrect approach that involves imposing a standardized grief timeline on the family disregards the individuality of the grieving process. Grief is not linear, and each family member will experience it at their own pace. This approach is professionally unsound as it can create undue pressure and anxiety for family members who are not progressing at the prescribed rate, potentially hindering their natural grieving process. It lacks empathy and a nuanced understanding of human emotional response. The professional decision-making process for similar situations should involve a thorough initial assessment of the entire family system, including each child's developmental stage and their expressed or unexpressed grief. The specialist should then collaboratively develop a grief recovery plan that is tailored to the family's unique needs, incorporating age-appropriate strategies for children and adults. Ongoing evaluation and flexibility in the plan are crucial to adapt to the evolving needs of the family throughout their grieving journey. This process prioritizes empathy, respect for individual experiences, and a commitment to supporting the holistic well-being of the family. Question 14. Quality control measures reveal that a certified pet loss grief recovery specialist is consistently receiving feedback from clients indicating that their grief is not being fully acknowledged due to a perceived lack of understanding regarding the depth of their connection with their deceased pet. The specialist's current approach tends to focus on the stages of grief in a generalized manner, without deeply exploring the specific nature of the human-animal bond for each individual. Which of the following approaches best addresses this quality control finding and upholds professional standards for supporting clients through pet loss? Option A. Redirect clients towards focusing on practical next steps, such as arranging for the pet's remains or selecting a memorial, to help them move forward more quickly. Option B. Implement a standardized grief recovery program that guides all clients through a predetermined set of exercises and timelines, ensuring consistency in service delivery. Option C. Gently suggest to clients that while their feelings are valid, the loss of a pet is generally not as impactful as the loss of a human family member, encouraging them to reframe their perspective. Option D. Emphasize the unique and profound nature of the human-animal bond in all client interactions, actively seeking to understand the client's specific relationship with their pet and tailoring grief support strategies to validate and honor that bond. The correct answer is D. Emphasize the unique and profound nature of the human-animal bond in all client interactions, actively seeking to understand the client's specific relationship with their pet and tailoring grief support strategies to validate and honor that bond. Explanation. This scenario presents a professional challenge due to the inherent subjectivity and emotional intensity surrounding the human-animal bond, particularly in the context of pet loss. Professionals must navigate diverse client expectations and deeply personal experiences while adhering to ethical guidelines and best practices for grief recovery. The challenge lies in providing support that is both empathetic and professionally sound, respecting the unique significance of the animal companion in the client's life. The correct approach represents best professional practice because it prioritizes a client-centered methodology that acknowledges and validates the profound nature of the human-animal bond. This involves actively listening to the client's narrative, understanding their specific relationship with their pet, and tailoring support strategies to their individual grief process. This approach aligns with ethical principles of beneficence and non-maleficence, ensuring that the client feels heard, understood, and supported without judgment. It recognizes that the grief experienced is a genuine and significant loss, deserving of professional attention and care. An incorrect approach that focuses solely on the practical aspects of pet loss, such as disposal or memorialization, without addressing the emotional and relational components of the human-animal bond, fails to meet the client's core needs. This approach is ethically deficient as it dismisses the client's lived experience and the depth of their connection, potentially leading to feelings of invalidation and exacerbating their grief. It neglects the fundamental aspect of recovery, which is processing the emotional impact of the loss. Another incorrect approach that attempts to quickly move the client past their grief by minimizing the significance of the pet's role in their life is also ethically problematic. This can be perceived as judgmental and dismissive, violating the principle of respect for client autonomy and their unique experience of loss. It fails to acknowledge that for many, pets are integral family members, and their loss is comparable to the loss of a human loved one. A third incorrect approach that imposes a standardized grief timeline or expectation on the client, regardless of their individual circumstances or the nature of their human-animal bond, is also professionally unsound. This rigid methodology disregards the individuality of grief and the diverse ways in which people form attachments with their pets. It can lead to feelings of inadequacy or failure for the client if they do not conform to the imposed timeline, hindering their natural grieving process. The professional decision-making process for similar situations should involve a commitment to ongoing client assessment, active listening, and a flexible, individualized approach. Professionals must continuously evaluate the client's emotional state and needs, adapting their interventions accordingly. This requires a deep understanding of grief theories, the dynamics of the human-animal bond, and a strong ethical compass that prioritizes the client's well-being and their unique journey through loss. Question 15. Analysis of a certified pet loss grief recovery specialist's interaction with a client who expresses profound sadness and isolation following the death of their beloved cat. The client confides that their family and friends, while offering condolences, have repeatedly stated things like, "It was just a cat," or "You can get another one," which has made the client feel unheard and ashamed of their deep sorrow. The specialist recognizes that the client is experiencing disenfranchised grief, where their mourning is not socially recognized or validated. What is the most ethically sound and professionally appropriate response for the specialist in this situation? Option A. Advise the client to try and explain to their family and friends the depth of their bond with their pet, and suggest they seek comfort from those individuals to gain validation for their grief. Option B. Reassure the client that their grief is likely an overreaction due to the absence of human connection, and suggest they focus on finding a new pet to fill the void left by their cat. Option C. Validate the client's feelings of sadness and isolation, acknowledge the societal tendency to minimize pet loss, and offer resources and coping strategies specifically tailored to navigating disenfranchised grief, while respecting the client's unique experience and pace of mourning. Option D. Gently explain to the client that while their feelings are understandable, society often views pet loss differently than human loss, and encourage them to focus on the positive memories and try to move past the intense sadness. Correct answer is C. Validate the client's feelings of sadness and isolation, acknowledge the societal tendency to minimize pet loss, and offer resources and coping strategies specifically tailored to navigating disenfranchised grief, while respecting the client's unique experience and pace of mourning. Explanation. This scenario presents a professionally challenging situation because it requires the certified pet loss grief recovery specialist to navigate the complexities of disenfranchised grief while adhering to ethical guidelines that prioritize client autonomy and the specialist's scope of practice. The challenge lies in recognizing that the client's grief, while valid, may not be fully understood or validated by their wider social circle, potentially leading to isolation and hindering their recovery process. The specialist must balance empathy and support with the need to avoid imposing their own interpretations or pushing the client towards a specific outcome. The correct approach represents best professional practice because it acknowledges the client's experience of disenfranchised grief without judgment, validates their feelings, and offers appropriate resources and support within the specialist's expertise. This aligns with ethical principles of client-centered care, respect for autonomy, and the commitment to providing evidence-informed support. By focusing on the client's unique experience and offering tools for coping, the specialist empowers the client to navigate their grief journey in a way that feels authentic and manageable for them. An incorrect approach that dismisses the client's feelings or minimizes their loss would be an ethical failure. This would violate the principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as it could exacerbate feelings of isolation and invalidate their pain. Another incorrect approach that attempts to fix the grief or impose a timeline for recovery would overstep the specialist's role and fail to recognize the individual nature of grief. This could be seen as a failure to respect client autonomy and could lead to a negative therapeutic alliance. Furthermore, suggesting the client seek support from individuals who have previously invalidated their grief would be a significant ethical lapse, potentially re-traumatizing the client and undermining the therapeutic process. The professional decision-making process for similar situations involves several key steps. First, active listening and empathetic attunement to the client's narrative to fully understand their experience and the nature of their grief. Second, identifying the type of grief being presented, in this case, recognizing the elements of disenfranchised grief. Third, assessing the client's immediate needs and support system, or lack thereof. Fourth, drawing upon knowledge of grief theories and best practices to formulate a supportive and ethical response. Fifth, clearly defining the specialist's role and limitations, ensuring that interventions are within the scope of practice. Finally, empowering the client by offering appropriate resources, coping strategies, and validating their emotional experience while respecting their pace and individual journey. Question 16. Market research demonstrates that individuals experiencing pet loss often benefit from shared support, but also present with a wide spectrum of emotional responses and coping styles. As a certified pet loss grief recovery specialist facilitating a group session, you observe a dynamic emerging where some participants are sharing intensely painful narratives of their pet's final moments, while others are expressing a desire to focus on happy memories to cope. A few members appear withdrawn, seemingly overwhelmed by the intensity of others' expressions. What is the most ethically sound and therapeutically effective approach to manage these diverging group dynamics? Option A. Allow the group to naturally gravitate towards sharing the most intense and painful stories, believing that catharsis through shared suffering is the most effective path to recovery. Option B. Intervene by suggesting that all members adopt a structured, step-by-step grief recovery plan to ensure everyone progresses through their loss in a consistent and manageable manner. Option C. Encourage participants to focus on the positive memories of their pets, as dwelling on painful experiences can prolong grief and hinder the healing process. Option D. Gently guide the conversation to acknowledge the validity of both intense pain and the comfort found in positive memories, while creating space for quieter members to share when they feel ready, and offering brief psychoeducation on the diverse nature of grief. The correct answer is D. Gently guide the conversation to acknowledge the validity of both intense pain and the comfort found in positive memories, while creating space for quieter members to share when they feel ready, and offering brief psychoeducation on the diverse nature of grief. Explanation. Scenario analysis. This scenario presents a common challenge in group therapy for pet loss, managing the diverse emotional responses and coping mechanisms of individuals who have experienced a unique and deeply personal form of grief. The professional must navigate potential transference, countertransference, and the risk of secondary trauma while ensuring a safe and supportive environment for all participants. The challenge lies in fostering connection and shared understanding without minimizing individual experiences or creating an atmosphere where certain grief expressions are implicitly discouraged. Correct approach analysis. The correct approach prioritizes creating a structured yet flexible environment that acknowledges the individuality of grief while promoting shared learning and support. This aligns with ethical guidelines for group facilitation, which emphasize creating a safe space, respecting participant autonomy, and facilitating constructive interaction. By actively encouraging members to share their unique experiences and offering guidance on processing these emotions, the specialist fosters a sense of validation and provides tools for coping. This approach respects the inherent diversity of grief responses and empowers participants to learn from each other's journeys, promoting healing through shared understanding and mutual support. Incorrect approaches analysis. One incorrect approach involves allowing the group to devolve into a competition of who suffered the most. This fails to uphold the ethical responsibility to ensure a supportive and non-judgmental environment, can lead to feelings of inadequacy or invalidation for those whose grief is perceived as less intense, potentially causing further distress and hindering the therapeutic process. This approach also risks creating an environment where empathy is replaced by comparison, undermining the core purpose of group support. Another incorrect approach is to steer the conversation exclusively towards the positive aspects of pet ownership and the joy pets bring. While acknowledging positive memories is important, an exclusive focus on this can inadvertently invalidate the profound pain of loss. Grief is a complex emotion that includes sadness, anger, and despair, and suppressing these aspects prevents genuine processing and healing. This approach can feel dismissive to those actively experiencing the acute pain of bereavement. A third incorrect approach is to impose a rigid, one-size-fits-all grief model on all participants. Grief is not linear or uniform. Forcing individuals into a predetermined framework can make them feel misunderstood, abnormal, or pressured to grieve in a way that doesn't resonate with their personal experience. This can lead to resistance, disengagement, and a failure to achieve therapeutic goals, as it disregards the unique nature of each individual's bond with their pet and their personal coping styles. Professional reasoning. Professionals should approach group therapy for pet loss by first establishing clear group norms that emphasize respect, empathy, and confidentiality. They should then facilitate discussions that allow for a wide range of emotional expression, gently guiding participants to explore their feelings and coping strategies. Active listening, validation of individual experiences, and the provision of psychoeducation on grief processes are crucial. The specialist must remain attuned to group dynamics, intervening to redirect unproductive patterns, and ensuring that all members feel heard and supported. This involves a continuous assessment of the group's emotional climate and a flexible adaptation of facilitation techniques to meet the evolving needs of the participants. Question 17. Governance review demonstrates that societal attitudes towards the significance of pet loss are evolving, with a growing recognition of the deep emotional bonds between humans and their animal companions. In light of this, a certified pet loss grief recovery specialist is working with a client who is experiencing profound grief after the death of their long-term pet. The client expresses feelings of isolation, as some friends and family members have downplayed their sadness, suggesting it's just an animal. Which of the following approaches best reflects professional best practice in this situation? Option A. Acknowledge the client's grief as a significant and valid loss, validating their emotional experience and providing support that recognizes the depth of the human-animal bond, while gently educating them on how to navigate external perceptions. Option B. Reassure the client that their grief is likely temporary and that they should try to suppress their intense emotions to avoid appearing overly distressed to others. Option C. Advise the client that while their feelings are understandable, they should try to focus on the practicalities of acquiring a new pet to help them move on more quickly. Option D. Suggest to the client that their grief might be exaggerated because pet loss is a common experience, and many people go through it without such intense emotional distress. The correct answer is A. Acknowledge the client's grief as a significant and valid loss, validating their emotional experience and providing support that recognizes the depth of the human-animal bond, while gently educating them on how to navigate external perceptions. Explanation. This scenario is professionally challenging because it requires a certified pet loss grief recovery specialist to navigate the complex and often evolving societal attitudes towards pet loss, which can vary significantly. The specialist must balance the client's profound grief with the potential for external judgment or minimization of their experience. Careful judgment is required to provide effective support without imposing personal biases or societal norms that may not align with the client's reality. The correct approach represents best professional practice because it prioritizes the client's individual experience and validates their grief as a legitimate and significant loss. This aligns with ethical guidelines that emphasize client-centered care, empathy, and the recognition of diverse grieving processes. By acknowledging the societal shifts and the increasing recognition of the human-animal bond, the specialist can foster a safe and supportive environment where the client feels understood and respected, thereby facilitating their recovery journey. This approach is consistent with the professional standards of care that advocate for a non-judgmental and affirming stance in grief support. An incorrect approach that minimizes the client's grief by suggesting it is just a pet fails to acknowledge the depth of the human-animal bond and the profound emotional impact of pet loss. This is an ethical failure as it invalidates the client's experience and can exacerbate their feelings of isolation and distress. It also demonstrates a lack of understanding of contemporary societal attitudes that increasingly recognize pets as family members. Another incorrect approach that focuses solely on the practicalities of replacing the pet ignores the emotional and psychological dimensions of grief. This is an ethical failure because it bypasses the client's need for emotional processing and support, treating the loss as a logistical problem rather than a significant emotional event. It fails to meet the core purpose of a grief recovery specialist, which is to facilitate healing from emotional pain. A third incorrect approach that dismisses the client's grief due to the perceived commonness of pet loss is also an ethical failure. While pet loss is common, the individual experience of grief is unique and deeply personal. Suggesting that the grief is less valid because others experience it is a form of invalidation and can lead to the client feeling misunderstood and alone. It demonstrates a lack of empathy and a failure to recognize the individuality of the grieving process. The professional decision-making process for similar situations should involve active listening, empathetic validation of the client's feelings, and a commitment to a client-centered approach. Professionals must remain informed about evolving societal attitudes towards pet loss and the human-animal bond, while always prioritizing the client's unique experience and needs. They should draw upon their training in grief theory and practice to provide appropriate support, ensuring that their interventions are ethical, compassionate, and effective in facilitating the client's recovery. Question 18. Research into the multifaceted impact of pets on mental health suggests that the human-animal bond can significantly influence an individual's emotional well-being. Considering this, which of the following best reflects the role of a certified pet loss grief recovery specialist in addressing a client's mental health in the context of pet loss? Option A. Emphasizing the potential financial and emotional burdens associated with pet ownership that may have contributed to the client's overall stress levels. Option B. Attributing the client's mental health challenges primarily to the pet, suggesting the animal was the sole source of their distress. Option C. Recognizing and validating the profound positive impact pets often have on mental health, and how this bond can serve as a crucial source of comfort and resilience during the grieving process. Option D. Minimizing the significance of the pet's role in the client's life, focusing solely on the human aspects of grief without acknowledging the unique bond. Correct answer is C. Recognizing and validating the profound positive impact pets often have on mental health, and how this bond can serve as a crucial source of comfort and resilience during the grieving process. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified pet loss grief recovery specialist to navigate the complex interplay between a client's emotional state, their relationship with their pet, and the potential for this bond to influence their overall mental health. The specialist must recognize the profound impact pets can have, both positively and negatively, on an individual's well-being without overstepping professional boundaries or making unsubstantiated claims. It requires a nuanced understanding of grief, attachment, and mental health support within the scope of practice. Correct approach analysis. The correct approach demonstrates best professional practice by acknowledging the established research on the positive impact of pets on mental health, such as reduced stress, anxiety, and loneliness, and how this bond can be a significant source of comfort during grief. It aligns with ethical guidelines that encourage specialists to be informed about the psychological benefits of human-animal companionship and to integrate this understanding into their client support. This approach is grounded in evidence-based understanding of the human-animal bond's therapeutic potential. Incorrect approach is analysis, an incorrect approach that focuses solely on the negative aspects of pet ownership, such as potential financial burdens or the emotional distress of illness, fails to acknowledge the widely recognized positive contributions pets make to mental well-being. This is ethically problematic as it presents an unbalanced and potentially harmful perspective that could invalidate a client's positive experiences and coping mechanisms. Another incorrect approach that dismisses the pet's role entirely, treating the loss as a minor event, is a significant ethical failure. It disregards the deep emotional attachment many individuals have with their pets, which is central to the grief recovery process. This approach neglects the core principles of pet loss grief recovery and can lead to inadequate support and further distress for the client. An approach that suggests the pet was the sole cause of mental health issues, without considering other contributing factors, is also an ethical and professional misstep. It oversimplifies complex mental health dynamics and could lead to inappropriate interventions or blame. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening to understand the client's unique experience and the nature of their bond with their pet. This should be followed by drawing upon evidence-based knowledge regarding the human-animal bond and its impact on mental health, while always maintaining a client-centered perspective. The specialist must then assess how this knowledge can be ethically and effectively applied to support the client's grief journey, ensuring interventions are tailored to individual needs and within the scope of their certification. Question 19. The monitoring system demonstrates that a client expresses significant distress and feelings of emptiness following the death of their long-term companion animal, describing the animal as their primary source of comfort and emotional support. Which of the following approaches best reflects an understanding of the significance of the human-animal bond in this grief process? Option A. Acknowledging the profound depth of the human-animal bond and validating the client's intense grief as a natural response to the loss of a significant relationship. Option B. Comparing the client's grief to that experienced by individuals who have lost human family members, implying their current level of distress is excessive. Option C. Suggesting that the client should consider acquiring a new pet immediately to fill the void left by their deceased companion. Option D. Minimizing the client's grief by emphasizing that it was just a pet and that they should focus on practical matters. The correct answer is A. Acknowledging the profound depth of the human-animal bond and validating the client's intense grief as a natural response to the loss of a significant relationship. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified pet loss grief recovery specialist to navigate the profound emotional impact of pet loss, which is often minimized or misunderstood by society. The specialist must acknowledge and validate the depth of grief stemming from the disruption of the human-animal bond, a relationship characterized by unconditional love, companionship, and emotional support. Failure to recognize this bond's significance can lead to inadequate support and further distress for the grieving individual. Correct approach analysis. The correct approach emphasizes the centrality of the human-animal bond in understanding and addressing pet loss grief. This aligns with the core principles of pet loss grief recovery, which recognize that the bond is not merely that of an owner and a pet, but a deeply reciprocal relationship that forms a significant part of an individual's social and emotional support system. Validating the intensity of this bond and its subsequent loss is crucial for effective grief work, allowing the individual to process their emotions authentically and begin the healing process. This approach is ethically sound as it prioritizes the client's lived experience and emotional reality. Incorrect approaches analysis. An approach that dismisses the significance of the human-animal bond by framing the loss as just a pet is ethically flawed. It invalidates the client's grief and can lead to feelings of isolation and shame, hindering their ability to seek or accept support. This approach fails to uphold the professional standard of empathetic and client-centered care. An approach that focuses solely on practical advice for acquiring a new pet without acknowledging the current grief process is also problematic. While a new pet may eventually be a source of comfort, rushing this process disrespects the mourning period and the unique bond that was lost. It suggests a lack of understanding of the stages of grief and the importance of emotional processing. An approach that suggests the grief is disproportionate or should be quickly overcome, perhaps by comparing it to human loss, is dismissive and unethical. Each grief experience is unique, and the intensity of grief is directly related to the depth of the bond. Minimizing the client's feelings based on societal perceptions of pet loss is unprofessional and harmful. Professional reasoning. Certified pet loss grief recovery specialists must adopt a client-centered approach that prioritizes validation and empathy. The decision-making process should involve actively listening to the client's narrative, acknowledging the unique nature and significance of their human-animal bond, and tailoring support strategies to their individual grief journey. This involves understanding that the loss of a pet is a loss of a family member and a profound disruption of a deeply cherished relationship. Professionals must educate themselves and others on the validity and intensity of pet loss grief, advocating for its recognition and appropriate support. Question 20. The audit findings indicate that a certified pet loss grief recovery specialist client is experiencing significant distress due to perceived lack of support from their immediate family following the loss of a pet. The client expresses frustration that certain family members are dismissive of their grief, while others are overly involved to the point of being intrusive. The specialist is considering how to best address this situation to support the client's grieving process. Which of the following approaches best aligns with professional ethical guidelines and best practices for a certified pet loss grief recovery specialist? Option A. Inform the client that family dynamics are outside the scope of pet loss grief recovery and that they should seek support from a licensed therapist for family issues. Option B. Directly contact the client's family members to explain the importance of pet loss grief and advocate for more appropriate support, attempting to mediate family conflicts. Option C. Encourage the client to clearly communicate their specific needs and boundaries to each family member and help them develop strategies for managing interactions with those who are dismissive or intrusive, while also exploring the potential for support from other friends or community resources. Option D. Advise the client to limit contact with family members who are not providing adequate support and focus exclusively on building a new support network through pet loss support groups and online forums. The correct answer is C. Encourage the client to clearly communicate their specific needs and boundaries to each family member and help them develop strategies for managing interactions with those who are dismissive or intrusive, while also exploring the potential for support from other friends or community resources. Explanation. This scenario is professionally challenging because it requires the certified pet loss grief recovery specialist to navigate the complex dynamics of a grieving family where support systems are fractured. The specialist must assess the effectiveness and appropriateness of different family members' involvement without overstepping boundaries or imposing their own judgment on family relationships. The core ethical responsibility is to facilitate a healthy grieving process for the client, which may involve leveraging existing support or helping the client develop new coping mechanisms if existing ones are detrimental. Correct approach represents best professional practice because it prioritizes the client's well-being and autonomy. By focusing on empowering the client to identify and communicate their needs to their family, the specialist fosters self-advocacy and strengthens the client's ability to build a supportive network. This aligns with ethical guidelines that emphasize client-centered care and the importance of respecting the client's existing relationships and personal circumstances. The specialist acts as a facilitator, guiding the client to utilize their existing resources effectively, rather than dictating who should or should not be involved. An incorrect approach that involves directly intervening to fix the family dynamics by dictating who should be supportive or by dismissing the concerns of certain family members would be ethically problematic. This would violate the principle of client autonomy and could lead to further alienation or conflict within the family, potentially hindering the client's grief process. It also oversteps the specialist's role, which is to support the grieving individual, not to manage their family relationships. Another incorrect approach, such as solely focusing on external support groups without acknowledging or attempting to leverage the existing family structure, might be insufficient if the family is a potentially valuable, albeit currently strained, resource. This fails to fully explore all avenues of support available to the client. The professional decision-making process for similar situations should involve a thorough assessment of the client's current support system, including family and friends. The specialist should then collaboratively explore with the client their perception of these relationships and their potential to offer comfort and assistance. The focus should be on empowering the client to communicate their needs and boundaries to their support network. If existing relationships are identified as unsupportive or harmful, The specialist should help the client develop strategies for managing these interactions and explore alternative support avenues, such as friends, colleagues, or professional support groups. The ultimate goal is to ensure the client has adequate support to navigate their grief journey.